Do you want to move? Yes.
Thank you, Caroline.
It's nice to meet you.
Thank you, Caroline, for remembering that I do not like hand mics from our jury experience last year, because I normally like to stand up and be able to walk around and talk, but I haven't had time to do anything like that today. So we've got it's the last slot.
Yeah.
We're not going to delay you, and we're going to let you go home early in good times, right?
Okay, all right.
But so we have a short message about an often forgotten part of the big county of Gloucestershire. And I know that's what you're all really responsible for, a much bigger area than ours. And that is the South Forest of Dean. I really wondered whether I needed to say anything earlier on, because I listened to a little bit of the Cheltenham representative saying how important urgent care was.
Yeah.
And that's really what we want to talk about. But we're about to face some exceptional circumstances. You all have heard that the tolls on the Severn Bridge have been removed. And this has caused a flood, maybe something like the Severn bore, of people seeking to come over and share our beautiful environment and live with us. They're naturally seeking to live along the main artery of the A48. Planners have been responding with remarkable alacrity, and house builders have actually been taking up the opportunity to build all the houses they've been given permission to build. And it's a rapid rate of knots, much quicker than even predicted a year ago. The increase in numbers will result in a population increase I can't really calculate, but it's a large number. I think 50% in the next 10 years of an increase in population in the South Forest. There'll be a new settlement, fourth only to Colford, Cinderford and Lydney, and larger than Newent, being created in the south of the forest, down to the close Chepstow. They're all English people. They may have Newport postcodes, but they're English and live in Gloucestershire. They may have Welsh doctors, Welsh registered doctors, but they are English residents.
Okay.
This is all occurring at a time when a new hospital is to be built. And following the recommendation of the jury, a lay jury, it will be located in Cinderford, which is further away from all the population increases. Whilst we understand no decision to close the two existing hospitals has actually been taken, we naturally fear that some closure will take place. We're not seeking to reverse in any way the decision to focus all beds in a single location, but we're wanting to ensure that at least urgent care facilities, that's the walk-in facilities, which people so value, and so many people value, currently provided at Lydney Hospital, continue to be provided until any replacements are commissioned in the South Forest. And it's partly due to the support of the Friends that the current MIIU facilities are well equipped and spacious. I think all will agree that. It's not a facility that is behind the times. The principle of having a single hospital was supported by the Friends on the assurances that were given to us that the towns that did not have a hospital would have a proper health hub. Cinderford already has the steel framework of a £5 million health hub, and the site for the new hospital has now been identified. Colford plans, I understand, are well underway for a new hub. But in Lydney, despite all the talk and assurances, nothing has been arranged or, I don't believe, being near agreed, unless I'm out of date by a day or two. We want to avoid the double whammy of increased population and decreased provision, causing the people of the South Forest to be seriously disadvantaged. The population of the Forest of Dean already has above average, over 65% of population, and the people moving in are people often with young children, who are also the people that need them. We very much appreciate that healthcare is, and quite properly and very well, naturally undergoing change, with technology, customer expectations, life expectancy, innovative solutions, all good things. There are many innovative solutions nationally, and from the do you know, I find this an awfully difficult thing to say.
Fit for the future, yeah.
Oh, FTF. Right, I've
Yeah.
learned something more today. Fit for the Future consultations. They're also being sought in Gloucestershire Innovative Solutions. Having been reading about these solutions and talking to locum advanced nurse practitioners who are moving around the country and seeing what's happening in other places, has made us understand there are many innovative ways urgent care can be provided. So we would ask, please, that you can assure us that Lydney services for urgent care, apart from any beds, we're not asking for any beds, will be maintained in Lydney and the South Forest until such time new facilities in the South Forest are operational. We ask you that in assessing the needs for new facilities, can we please be assured that account is taken not just of past and present demand from patients, registered with English doctors, that's what some of the stats that have been put out show, but also those local Gloucestershire patients who are registered with Welsh doctors. And don't forget that many people living in Gloucestershire have a Welsh postcode or a foreign postcode. It's not just postcodes. That the current statistics used, as opposed to historic statistics, will be used to predict the future. Can you please work with local authorities to help plan on these things? And have you considered Lydney Hospital as a future healthcare base? Lydney and the South population will be well over half the population of the Forest of Dean in future years. You say in your Fit for Future booklet that you want to make it easier, faster, more convenient to get advice, support and services 7 days a week. And you want to provide the majority of care in or near your home. Currently, we feel the outcome will be the opposite. It'll be more difficult for people in the South Forest to get advice, support and services. That care will be further from the home. With the centre of population moving south, it will be an increase in patient miles. So please listen to the rapidly increasing number of people in the Forest of Dean, south of the forest, and give them the quality of health care that they currently receive are entitled to. We may not be as many as Cheltenham, but we're quite a lot of people, and there's a lot of press going on at the moment. So we would ask you to ask us questions, and if you run out of time, we'll ask you some.
Okay, all right. Sounds like a deal. All right, so any questions? Anybody want to open with a question?
Can I start?
Yeah.
Hi, Kat. Oh, my name's John Campbell Thurston.
Yeah, but mine's got no P, so I'm
Oh,
special.
sorry. Okay.
I'm very interested to hear about you saying about urgent care in your communities. Could you describe what you think is part of urgent care? What does that make up?
Well, what I did, and I was very pleased to see in your Fit for the Future documentation a definition, and also see on other things. And it's really good to see the difference between emergency and urgent care. And I take that urgent care description you put down as being what is needed. Right? So I look at your description of getting that walk-in advice, even if walk-in is slightly by means of phoning up and getting an appointment from a referral, that you can find out something straight away, almost at any time of the day, and I said day, not night, right? That you can get that attention. Because that's what people want now, because you can't, sorry, there's a doctor GP around somewhere, you can't get GP appointments unless you're dead, right? You know.
Can I just follow on that question just a little bit further? And what would good look to you from an urgent response? So if it isn't just, we'll call it an MIU for sake of argument, if it isn't that, what could it be that could be delivered within the locality of the forest, particularly around your Lydney and your growth in population? Do you have a view about what that could be?
Well, I think good would be what our present MIIU is at the moment. We have X-ray as well, but I realise that's very difficult to provide the person to work it. So I would probably let that go if we had to. Although we'd fund a new machine if we had to do that, we'd fund that from the Friends, because the Friends are happy to support any facilities in terms of wherever we can. And I think what would be, it was something I think that maybe get attached to GPs, maybe. But we're not the ones developing the innovative solutions. But good would be to walk in when you want to get advice and help with a this or that or a minor illness. Mary. Sorry, I must tell you, my wife is chairman of the trust, and I'm here by her command because she said I should say something.
I'm pulling the strings behind.
Did you want to say anything, Mary, at all?
She's doing fine at the moment.
Okay. All right. There's the option there if you want to, yeah? Yeah. Yes?
Clearly, you're right to say that it's for us to think about sort of what innovation looks like, and I think that's a really important word you're pulling through. It's how do we innovate within our localities and communities. You talked about best practice elsewhere. Now, we've done looking at other areas, but have you got any particular areas that you've heard about from talking to these nurse practitioners?
I read in the press things that have been done elsewhere. There's a place where there's a Boots here, and there's a walk-in urgent care above and a GP surgery above that, combining the things together with a pharmacy on site, etc. It's combining the facilities together, so maybe you say receptionists, etc., that sort of things. Okay. But I think there can't be one answer.
No.
We've got to look around and see what fits us, what do we really need.
Yeah.
Mary, what would you like to see in urgent care? I think people appreciate being able to come in at almost any time, and have someone that's going to either tell them they're okay, or do something about it, etc. Because, quite honestly, waiting for GP appointments is not easy.
I think it's reassurance or signposting to the right place.
Okay, thank you.
I'm really interested in walk-ins and appearing at a clinic or appearing at a place that delivers care. Have you thought any further about what could happen broader than that, maybe in the patient's home, and how we can respond better to, because there's some people who just couldn't get themselves to minor injuries. There are other needs. Have you thought what it feels like for your area for that kind of provision?
Not in a big way, no, we haven't. Sorry, I'm not a medical person. Mary, you might have.
We have a very good rapid response.
Yes, you do.
I
I manage those rapid responses.
sorry.
Yeah, you wouldn't know. Yeah.
And I would like, in this new health hub that we would like, to have the rapid response working with the rest of the community things, and I think it would work very well. I know the rapid response is going into Lydney Hospital at the moment and offering a very good service when we need it. Absolutely. So that's the sort of thing that I was hoping for.
And I also believe that district nurses, in the geography of the Forest of Dean, will need to have bases in several places.
Currently have bases around the county. They base themselves in one particular. There's bigger bases around your localities. There is a synergy between district nursing, rapid response, minor injuries, all of which I manage some of those services. So I think we do need to explore, maybe what you're telling me is exploring how those interdependencies and integrated working can work a bit better alongside our out-of-hours colleagues who we would love to strive to work better with.
Yeah, of course you can. Yeah.
Sorry,
right,
sorry, we can come over that side in a moment. The title of your presentation, which sort of resonated with me, was around same-day urgent care. Now, we're very much talking about your minor illness and minor injury type activity. Sometimes when we think about same-day urgent care, we also think of the slightly sicker patient that currently may be attending our acute trust and spending a bit of time there. But there is a view in some localities around providing more enhanced support in localities around supporting patients such as point-of-care blood testing. Have you had any thoughts or communications with your GPs around that?
No, we haven't. But that would be, does that move on to ambulatory care when you're doing blood testing?
It's similar,
that would be absolutely great, but I didn't think we should ask for that far.
Well, I think when we think about innovation, you want to innovate in Lydney, and I just wondered whether it was any sort of thoughts or conversations you'd had with your GPs about what that could look like.
We did have a sort of a private conversation with them, yes.
Right.
But we haven't. It hasn't moved anywhere.
Okay.
But I understand that the blood's also rapid response.
Yeah, yeah.
Yeah, I know they're doing that
Yeah,
at the moment
yeah,
in the area.
yeah.
So,
And there is ways of getting quite quick blood answers back if you have the right machine and you pay the right money for the answers rather than put them off in a
Yeah,
van
yeah.
and to go and collect them. And we don't seem to do that, and so why can't we do it?
Yeah.
Right.
Okay.
I think, yep, Mark?
Thank you. I'm trying to tease out what you consider to be the important principles, and I'm getting the sense that the physical location is less important than the immediacy of the access and the reassurance and signposting. So if that was provided in a number of different locations but was easily accessible, would that be something that would be
Well,
of interest?
I think-
I accept the point about you're only going to have one X-ray machine
Yeah, okay,
in a
okay.
physical location, but is it about the outcomes
Well,
that you want, which is...
I think easy accessibility means transport routes, right? And transport routes in the Forest of Dean are not straightforward, especially when you get bad weather. The A48, which goes from Gloucester to Chepstow, is low-lying, open all the year, and you don't have to go up to 800 feet to get to it, and it doesn't get snowbound. Staff can get there and all the rest. So having something at low level with easy blue light, if necessary, to Bristol stroke Gloucester is a very good location to have things rather than tucked up in the hills. And so I think it's easier for people to come down to an artery to get to their location. To get a bus route up into it's impossible. You have 3 bus changes to get from Lydney to Cinderford.
But do they still have the problem afterwards that if they need to return home, there's still that return journey? And
Yes, there would be
we've
if they
heard
are
a lot
returning
today about
home, but
that,
they've had
yeah.
their treatment. Yeah.
But they've had the treatment, yeah.
And staff can get there as well.
Yeah.
I think there's a lot to be said for having somewhere that's weatherproof.
Okay. Yeah. All right.
Was that the answer you wanted, Mark, or not?
Well, I'm just trying to tease out whether it's about, effectively about a building
No,
or,
no, no,
or
no.
about the service.
No,
Because
it's the
you were
service.
the one that mentioned boots, for example, and we all
It's
know
fine.
that there's lots that's possible in other
Sorry.
using already existing locations. It's often easier to provide additional services out of them than to
Right. Okay.
centralise in one building.
We are not wed to our building, right? We are not wed to our building, but there is no other building at the moment. And it may be a good idea to continue to provide them in the existing building until you've planned to do something else. And I think that's the point we're trying to say, is it could be an intermediate step for 5 years while you work out what you're really going to do,
Yeah.
right? Because at the moment, your time plans are so far out, it's going to be a problem. And we're saying there's going to be a definite problem if the hospital opens on time, and you wanted to close out of Lydney. That's a big problem. Because you can't get anything else up in Lydney in time. So carry on where you are.
Okay. Yeah.
You did mention earlier on about English patient provision, so those people who may have a GP that's over the border or live over the border and have...
Yes.
I'd like to be able to at least reassure you that we do not look at the GL code and say no. We look at the patient need in urgent care. And in the services I manage, I hope...
I know they get served, but the statistics I have seen come up recently were the visits to MMIU out of Gloucestershire registered GPs.
Right, okay.
Right? So the statistics that were being looked at aren't altered. We also get a lot of refugees from Wales over trying to come from their health system into our health system, which is brilliant, right? And we do get a lot of people from across border as well. They're coming across to us because they know they get better service here and don't want to go down to Newport. So you are dealing with quite a lot of those. And I believe the protocols are being developed within our Bevan Trust and all the rest as to how those things are being dealt with. Have they?
Okay. Any further questions? No? If you want to ask some questions.
Mary, what would you like to ask them?
well, I think we've covered quite a lot.
Yeah.
I say we're not here to sort of tell you what to do, but we're just trying to point out the problems that we can foresee with the population expansion. And we're here just to represent the people from the south who we feel are really being forgotten.
Yeah.
And the press that came out on the announcement of the local site of the local hospital, half of it was adverse. What's going to happen in the south of the forest and to others? It was not all positive. So the coverage locally, people only just become aware what might happen. Right? And so there's going to be quite a lot of people shouting, and we'll try and keep them under control if we can make a sensible offering to them, if you can make a sensible offering. And that's the way we've always worked, I think. We've tried to sort of be between health authorities and the public in getting the public to accept reason. But it's difficult.
But we as the Friends are very happy to support and do what we can
And
to work with you as well. As I'm
yeah.
sure Mary
And we've got, and we, you know,
Yes.
I think we do try and continue to do that, and we'll
We don't want
continue
to
to,
be confrontational.
and we'll
We want to sort of,
Yeah.
right, you
work
know,
with
we want to support, and we're supporting the hospital at the moment. I must admit, some equipment was just given to minor injuries units. We've lent you on loan. So in case you close it, we can move it to somewhere else. But enables us to be able to do things like that, right?
Yeah.
And that's flexibility on both sides, right? And I don't think it's unfair. Right.
Indeed. Okay. And no, any further questions or anything else anybody wants to talk about? No. Well, in which case, thank you very much.
Fine.
And,
Okay. Thank you. If
I think that you know, from what you've said, it is logical. People will obviously look at making sure that there is a sensible progression, you know, between now and obviously the establishment of the hospital.
Good. Okay. Right. Lovely. Thanks very much indeed.
Okay.
Thanks for your
Thanks
help.
very much. Yeah.
And yeah. Okay. We'll let you go home early.
Indeed. Okay, so I don't know. We're at 4:30. We potentially have a little bit more time. If there's anybody audience-wise, or we've had anything online that anybody wants addressed, or as there's an opportunity, no. Well, in that case, ladies and gentlemen, it's for me to wind this meeting up, and just a quick reflection on what we've heard today. It's been an interesting day, and we've heard from councillors, we've heard from campaigners, we've heard from different people with different perspectives, and you've got a bit of the range, I think, of the different things that people need us to consider. Certainly things like outside of the specifics of A&E at Cheltenham, I think there's a couple of recurring themes there: education of the public on access to facilities, and then the access itself, transportation and things are things that need to be looked at in some detail. So the information that we'll be able to take from the transcripts of what's come out today should provide us with a foundation for looking at further things, but also testing those things further with other bodies. But unless there's anybody else got anything to add, I think they're on concluding that. No? Anybody want to? No? I think that we'll call it a wrap for today, and thank everybody for taking part. And thank everybody in the panel here for your contributions and for the support of the observers from the Trust in the CCG and other parties there, and audience as well. So thank you very much, everybody, for taking part. Okay, thank you.